Hey,
There you.
Charles,
Yeah.
we're live, Charles.
Hi,
Uh,
everybody. Hi. I'm home.
oh my God. Oh, hang on here. Golly, I knew that would happen. I knew that would happen.
What happened?
I knew that you would do that when we went live. Oh, boom. Okay, that one's fixed. Ah, my gosh. I tell you, Charlie, I tell you. And this one is boom. We're on. Hey, Charles.
Yeah. Yes.
We're live, Charles. We're live.
Hi, everybody. Welcome.
Aloha Friday, everybody. Aloha Friday. Welcome to Mel and Charlie live on Facebook. What a long day. I
Yeah.
tonight I got coffee, Charles. I'm tired and it was hot all day. So I get coffee right now.
Good.
And I
Hey.
made the coffee a while ago and I
Yeah.
put them in an ice box, but the coffee one is still hot. This thing, this here, this Yeti, this Yeti thing that we got
Yeah.
from Deja Vu keeps
Yeah.
things hot. Keeps things hot. Even if you put them in the ice box.
Where'd you
It's
get it from?
Patsy won this on some kind of social media or Instagram contest. So this is
Yeah.
she won this from Deja Vu, but
Oh,
it's a Yeti. These things are amazing. This stuff is like
where can I get that?
Deja Vu.
Where's that?
The one in Kapa, I think one in
Okay.
Kukui Grove.
Okay.
You know what, Charlie? I'll get you one.
No, no, no. I just wanted to make sure because I got 5 of those cups. I just wanted to make sure I went to the right store.
Oh, okay. Well, anyway, is that a
So,
women's T-shirt I see in the back? Oh yeah, share, people, share. We got Dr. T tonight. Dr. Trpkovski will be coming on shortly. He's going to talk about our testing that
yep.
we did last week Wednesday, and a whole bunch of other things. But yeah, what do you got there, Charles?
I've got this new shirt that was put out. Kauai Strong. Okay.
Yeah, I get the other design. We get two designs, and mine is not
Yeah.
coming in that clear. But so that's the with the island,
Yeah.
and well, they both have the island,
Yeah.
but mine get Kamehameha on top. Mine get. Can you see that? Is it clear?
Yeah. Yeah.
This is the black. They have, all the shirts, all the colors are different. If you go to the website, which I'm gonna punch in right now, 808
Brother.
dash
He
T.
gave you the wrong shirt.
Huh?
That was supposed to come to me. That's blue and white, right? Yours on.
Black. This one is black. Black.
No, but the design is blue and white. That Kamehameha on your shirt. The
Purple.
design
Purple.
purple and white.
Oh, it's beautiful, man.
Because I get over here, you're red and white. You see up here, red and white.
Oh, the St. Louis one. That's blue. The blue shirt comes with the red and white.
Oh, okay, folks. Right there, it is a ladies' tees. Comes in ladies' sizes. It comes from small, medium, large, extra large. Then anything above extra large, then you get regular t-shirts because you cannot use tank top when hang out from the side. Okay, because it goes up to a large. So you women out there, if you're beyond a large, you cannot get them in tank top. And then of course you get them in the shirt.
Look at Sherry coming. She says, Uncle, you should have Kamehameha on your shirt in the middle of Kauai Strong, and I should have Frank De Lima.
Okay.
I get no respect. This is the black background.
Yes.
So we get black, white, red, green, blue, gray, purple. No more purple, sorry. But go to the 808-tees.myshopify.com. You'll see that I just put it on the on the post on the thing. So go ahead and check it out. We're gonna be uploading some pictures of Charlie modeling the shirts.
Yes.
Patsy said, "Oh gosh," but I hope Kirk is ready for that because Charlie, when they see you ordering, and I'm gonna put the 10th sale, gonna get to have a free date with Charlie Iona, free lunch or dinner.
No,
whatever.
I took, just to let the viewers know. You wanted me to take a model's a shirt. I did. I went down a runway. I never pay attention. I would slip off the side, went straight down. Nothing happened to me. It's just that I had to go find one concrete store for go put past the concrete because I'm bust the floor a little bit. So that's about it.
Kirk Korea Island Athletic Tees are the ones doing the shirts. So go ahead, and I know when you guys order, I did the website, so it's kind of showing that it's all coming from me, but it's not. I'm sending everything over to Kirk. He's filling the orders, he's sending them out and all of that. So
Yes.
got a few comments on my Okole Puka shirt in the past days. You know, we went to the testing. At the testing, Charlie and I both wore the Okole Puka shirts, and
Yep.
ended up a lot of inquiries, and I think we sold a few. But yeah, I mean, it's just unique, and you know, this is a one-time only deal. I mean, you know, it's COVID. It's a COVID shirt, so we just want to thank Kirk again, Kirk Korea.
Lot of non-Hawaii people liked it because they said, "Hey, buddy, does that mean it's a hole-in-one?" I go, "Yep, that's a golf shirt. Okole Puka, hole-in-one." Mhm.
It's so cool. One of the nurses on the line had no clue what that meant,
Yeah.
and we never tell them. But she ordered one anyway, so she'll go. She's from Honolulu. I mean, she's gonna be walking around Honolulu with that shirt, not knowing what the heck it says. So I think that'll be pretty cool and funny.
Yep.
But Kirk Korea Island Athletic Tees, guys, get the shirts. You know, he'll be posting up more different designs too. If you got any design ideas, let's get it over to Kirk so he can start putting up
Yes.
the shirt. I know we heard of so many on the line. We heard so many on Wednesday. So anyway, it's pretty cool, pretty fun. So, how was your day, Charles?
Well, I just want to say that got into a little skirmish online, but it's expected. You know, there's been so much issues about what's been happening, and again, folks, and you know, I might have misspoken. I might have taken it too personally, just because of the responses. But you know, like I said, Mel, if I'm wrong, I apologize. But I know what I read. I know what I read. But it wasn't nothing bad. It was just the way it came out, like a duh. And you know what? I'm not a duh. So the way it came across, I might have misread. So you know, I apologize to the person. But other than that, you know, all I can say is this for the state. If there's a backstory to anything, and you're telling us that there is, because the way the climate is right now, I would suggest you spill the beans and tell everything, because Hawaii people are pretty educated. Get it out there so we can buy into whatever program you have. Because if not, you're leaving it up to us to interpret what you're putting out there right now, and it's a bunch of hogwash. We're going to go that route. So don't blame us. That's all I'm saying. You want us to buy into your program, have the common courtesy. The people that actually, you know, put the checkbox by your name and get you in office. Yeah, just give the common courtesy to let us know so we can buy into the program. Like the traveling, what the travel ban or whatever you want to call it, how it's going to work. However you're going to do it. But don't tell me that there's a science behind it. Because the science you're telling me about, it's the science of, I'm not going to tell you what it is. It's a secret. It's a science. Then then you leave people wondering countless hours thinking, you know, is it this? Is it that? Is it this? Is it that? Then ultimately, you know who gets hurt? It's our travelers. Because we get so frustrated and it focuses on them. Guess what happened? The innocently will be walking around on target. I don't want that either. If you folks have something in mind, spill the beans so we can just get over it and we can move on. But right now, Brother Mel, you and I both talked about this right now. There is no check and balance system. There is none whatsoever. And until you can come on this show and tell the viewing audience, no, there is. I dare you to do that. And guess what? Who's ever been on this show will tell you we have never backed anyone into a corner, because we are not a-holes like that. We let you come on, we let you talk. We will not back you into a corner. So there's no reason for you to be afraid of us. If we can be that venue so you can get your message out, and I even invite the governor, you come on this show, we give you 1 hour, we will not interrupt you. Make sure, Governor, you have one script. Because right now, your script that you're talking going all over the place. Have one script so you can follow. Tell your story. And if it's convincing, like I said, Hawaii people are educated people. We will buy into it. But you give us no choice right now. And that is the problem.
Two things, Charlie. Two things. Transparency, right?
Yep.
Exactly what you're talking about, and respect. And
Yep.
maybe three things: courtesy to all of
Yep.
us. You know, you're forcing the social media communities to create their own theories because we're just not being told. And you know that's the frustration, I think, Charlie, and that's why we try to get them on the show. But you know, we got the two big things right now in the last 48 hours is obviously the travel. That's a cluster F. You know, that's what it is.
Yep.
We're trying to figure out what the heck they're trying to figure out how they're gonna get this in place, trying to assure the public that it's safe. Well, everywhere you look around the country is blowing up. Is blowing up. Records every day blowing up. And then the other thing is the raises, the pay raises, approval of the pay raises for the state workers and county workers. A lot of people, again, you know, you got it's divided. A lot of people say, yeah, we should get our raises, and the other one says, hey, now is not the time. I happen to say it's not the time. I think we should, and I said this early on, Charlie, if you remember. I asked, well, I didn't ask. I said it's time for the unions to be the leaders and willingly postpone the raises until we get to a point where we're fiscally adequate. And that's what I said. I didn't ask. I should have asked maybe, but you know, at the end of the day, I knew it would get to the legislature, and I was hoping that the legislature would say, you know, we understand and we do want to recognize and honor all contracts, and but it comes with a caveat that you got to have the funds. You got to have the funds available, and right now is not the time, in my opinion. But that'll be a discussion for another day. Dr. T is all here. I'm gonna bring his Okole in. Oh, hang on, Doc. Hang on. Let me
Hey,
hold on, Charlie. Can you see Doc? Doc is, yeah, Doc, you're sideways.
oh,
Doc.
okay. I can fix that.
Oh, okay. Oh, that's better. Whew. My neck was getting sore.
Okay.
Okay, now we
Eh.
see the T. Dr.
Eh.
T. I think he must have got a phone call. I think that's
Yeah.
what happens, you know. When you get a phone call, it like, boop. Oh,
Ah,
there he is.
there
you
we
go.
go. You like
Hey,
this
Doc.
better?
Oh, yeah,
Alright.
much better. My neck thanks you.
I don't know. Last time I thought, I don't know which way I was looking, but okay.
All right, Doc. Thank you for
Here we
joining us
are.
tonight. Aloha. I know you look like you're still working, so.
Yeah, I'm still working. So I might have to step out every now and then, but I'm the only doc here tonight. But
Oh, God.
you got me. I'm
Okay,
ready.
man, let's get right into it. Everybody knows
Let's
who you
get
are.
into
Dr. T, Doctors of Waikiki came down last week, or not, this past Wednesday, set up shop with 5 of his employees, his staff, ran a clinic, a testing event for COVID
Yeah.
antibodies. So, Doc, I'm going to turn it right over to you and give us a lowdown. What did we get? What did we find?
So we tested approximately 188 people. And of the 188 people on Kauai, only one had antibodies. Of the one that had antibodies, we did a nose swab and it was negative. So we really had no actively infected people out of the 188, and only one had antibodies, which is a much lower percentage if you do the math than what we've been doing in Oahu, you know, because we've been getting, of the general public, it's about maybe, I'd say 0.3% of the general public. And of the first responders, a little bit more, maybe 0.4. I think that ends up being like 0.2, 0.02, you know, 0.2.
Kind
Let
of
me
what
do
you
the math.
expected. Kind of what you expected, right?
No. Well, it is what I expected. You're right. It is what I expected because you guys have very low cases. The amount of people who are infected on Kauai is very small. And so out of all the islands, I think Kauai has the least cases, correct?
Correct.
Yes.
Besides like the bigger islands, you know.
Correct. We,
So
we recently we have a couple of active clusters right now. We just had another positive today. So that they're still contact tracing those two. They're saying it's kind of like the same family in two different households. So, but we every day we wait for that report to come out. Everybody's, on pins and needles waiting for the report because.
well, that's what it could be. Exactly. It could be the
Yeah.
same household,
Well, Doc, let me ask you a question. We've talked about this before, and I think I talked with you in brief during that day of the testing.
Yeah.
We know some people got it and got stricken with it really quickly, and some people took over a period of time. So, because this virus doesn't have a singular characteristic, what attributes to how it if it's going to attack someone? What are some of the things that you know of that can be maybe factors in it?
There's a lot of things they're finding. They think there's some genetics. It's also okay. So if we look at any virus, any respiratory virus, or any virus or bacteria in general infection, it has a lot to do with the viral load or the bacterial load. So if you get exposed to 1 or 2 virus particles, or you get exposed to 100 virus particles at the same time, that makes a difference. Okay. 2, the person's general immune status, the person's well-being. If they're pretty healthy and everything's okay, their first line of defense, their nose, their respiratory membranes, they could somehow block off infection if it's not overloaded by too much of a viral load if they're pretty healthy. And then we think there might be a genetic component. So they're looking at certain blood types or certain types of people that have certain genetic makeup might have a lot less chance of being infected or being susceptible. Or if they get infected, they don't get that sick. They don't get sick at all. So I think they find that O positive blood decreases your risk of getting the virus altogether. Now, I don't think it means you can walk around and get O positive blood, you're not going to get it. You can still get it, but they're looking statistically, they're seeing that less people with O positive blood are getting sick or getting the virus.
Is there a primary reason, having what you've just said? And I think it's important information to at least get some kind of understanding of it. Why do you think they're not sharing that kind of information? Do you think that maybe people might take it in a wrong way and walk around like, hey, I cannot get it because I get O positive blood, or
No.
They think that you won't understand it?
Well, I think a couple of reasons would be we're not sure yet. A lot of the stuff, even the stuff I'm talking about, is just hearsay. We don't know. But We're looking at the numbers, and that's what it sounds like. But it might not be true as it pans out, because we're only looking at a small percentage of people. Not everybody in the world has been tested, or in the United States for that matter. I think we're at 5% of the population in the United States. Not that many. But I don't think they're trying to hide something from us. I think it's just we don't know, Charlie. We just don't know,
So one last question, and I'll turn it over to Mel. The EU just announced, and places like Australia, they've cut off their borders, and rightfully so. When they did the comparison with Spain, Italy, Germany, places like that, they're in the hundreds of thousands while we're in the millions. Is there a reason? I mean, could it be that they started to practice the necessary means to fight this thing faster than we did, or how did it just get out of hand? I mean, especially with those states that are brewing like in the 40s of thousands, right?
Right. I think it might be, they're islands also. You got to think about it. Australia is an island, a big island, and so is New Zealand, right? So similar to us, there must be some factor based on that. There's not that much. There's limitations on how to get to Australia, limitations how to get to New Zealand, limitations in getting to Hawaii. That's one factor. There might be some other geographical factors. We don't know. But I think they shut down early. Like Hawaii, I think we shut down right after Australia. Am I correct?
March.
Yeah. So in reality, the states couldn't shut down. State by state, people can drive to, each city, each state freely, right? So there was really no restrictions there like what we're dealing with, like we were able to do here in Hawaii and probably New Zealand and Australia. So I would attribute it mostly to that, that they were able to control their infection rates because they were able to isolate much better than anywhere else, just like us. Now, could there be some other factor? Maybe because the closer you are to the equator, who knows? But I have no idea. But I know we isolated. If we would have isolated even sooner, it would have been even better.
Okay. All right. Thank you.
There are a lot of theories out there. Every time some new development comes up, the scientists and the doctors, they put out a theory, and and I'm all positive. I was very happy to hear when that came out a while ago, and I was very excited. But still, I mean, it seems like every time you turn on the TV or you click on a news link on the internet, there's some other theory or some other finding that was just created or made. And but the bigger news that's consistent right now is how this virus is blowing up in so many places in the country right now.
Well,
And that's scary, right, Doc? I mean, is that something that
terrifying.
I'm listening to the experts, I'm listening to, and I hate people that make this political. I hate the congressional and the national level politicians who's always looking for a political angle. But I don't care who's talking about it. I don't care what party you're on. The fact of the matter is that we have states that are blowing up, and people are freaking out. And we see, although we are geographically far away, with the impending lifting of the quarantine, a lot of these guys are going to want to get over here. But how serious is this increase in cases? That, I mean, it's exponential.
Well, it's pretty serious. Think about it. So through my colleagues, I've been getting I've been hearing about the numbers in the other parts of the United States where they're having increase in the cases of coronavirus. So more cases means more sick people, more very sick people, and the very sick people end up in the hospital, and the very sick people end up in the ICU. So we look at those cases, their ICUs are almost at maximum capacity in some of these states that are getting, these resurgences. And so what's going to happen is it's going to be just like it was back in February and March, overwhelming. And then it's just going to continue to snowball and get worse. I mean, I think we're really lucky. We're really lucky we didn't have too large of an outbreak. One, we're really lucky that IGE that finally came up with a solution with the testing. That's great. And I think we're never going to have that situation that everyone else is dealing with because of that. I think we'll have little outbreaks here and there. But if everyone's getting tested as they come to Hawaii, the chances of having us a large resurgence like that would be very small, because we'll have some people slip through. Nothing's 100%. But of the small people that slip through, they'll do contact tracing, isolate them, and we shouldn't have a large resurgence because we're not going to have a large overflow of people coming in and congregating that have corona. But in the other states, like in Florida and Texas, and these other states are having major outbreaks and resurgences, first off, Americans in general want to be free, right? We're the land of the free. Nobody wants to be told what to do. So wearing masks and following social isolation norms, especially in mainland USA, I think is more difficult. I think we're being much more respectful and observant of the rules that we're for consideration of others' health than I think they're doing everywhere else. And on top of that, they have high numbers. And so it's only going to explode. They're all going out. They're all socializing, going to the beach, going to bars. It's just going to get worse and worse. So, but I don't think there's any other reason except they have a lot more cases than we have. Our cases will go down with time. Eventually, we'll get down to zero. We'll go for weeks without any cases. And then a few cases might pop up in the future. As long as we control it like we've been doing, it's only going to get better in Hawaii. But these other places are going to get worse unless they shut down. If they can shut down the cities and say, okay, we're going to have to shut down again for 2 to 4 weeks and nobody go out, everyone stay home. That's what they're going to look at. And then Fauci came up with some other ways of testing. He's saying they can do what they call pool testing. And that's what they were doing in China, where they test, 1,000 people. And if nobody is positive, then they continue to the next 1,000 people, like a broad net. If they find a few positive, then they go after them and isolate them, But we'll see.
Okay.
The fact that the governor is allowing people the choice of taking a test or not taking the test before they come and going to quarantine. But the problem, Doc, is, and what I've been getting messages and emails from people on the mainland is that it's going to be difficult for them to get a test inside that 72-hour window, because on the mainland, many of the locations is taking 3 to 5 days to get a test result.
Well,
So those people are not going to qualify for the quarantine-free vacation.
well, when they come, then we need to police them a little bit more stricter, or don't come to Hawaii. Or when you come here, go someplace and get tested. We can test them, so any place else can test them. But I really think if you want to go somewhere and they set it up in the right way, people will get tested. And if they can't get tested, they won't come. It'd be simple as that. I hope so too, but I still think people are going to slip through, guys. But
Oh yeah.
but we've set up a barrier now, which is good. We've set up some kind of barrier. It's not like come one, come all. No. There's some rules there. You got to get tested. If you're not, you're going to go quarantine. And then we'll have hopefully some more people getting involved. Maybe we'll do community groups so we'll watch and monitor tourists as they come. I don't know how else we're going to do it. Or the police should do it, but they're not letting the police do it. But I really think it's going to help. There's no perfect solution to this. It's too much for the airports to do all the testing. So they should just let the people find a way to get tested. If they can get tested, come to Hawaii. If not, you got to quarantine. And if you quarantine and you want to get out of the quarantine, come get tested somewhere in Hawaii, and we'll let you, relax and continue your vacation. If not, you've wasted 2 weeks of your vacation. So as soon as quarantine's over, you got to go home.
Yeah.
Well, Doc, I think you hit the nail on the head when you said earlier that the attitudes are different in the mainland.
I think
they want
so.
to be more free. And so that's part of the problem that we're experiencing now, that when they come here, they transpose that attitude from there to here and think they can carry on that way. And
Right.
It makes it a hell of a lot hard, because, we're in this sort of like a cat and mouse game. And, at the end, the one that's picking up the tab is Hawaii, because
Yeah.
we put them back on a plane and we set them back. It's not on their dime. So
we should make them pay.
Yeah. and the funny thing is, they have it in the governor's proclamation. It's in there. Why it's not used, I have no clue. But someone had asked 2 questions. First question, they had asked about the antibody accuracy of the test that you did on Wednesday. What's the accuracy on that?
They're 99% specific and 98% sensitive. It's very accurate test. I've tested them because we've tested so many people, and we've tested so many people that had corona, that had positive, no nasal swabs, and everyone had showed the antibodies. Everyone. I've had no one slip through. The test is very accurate. Now, there are some tests that are not that accurate. Luckily, that's not the test we have. We have a very accurate test. It's FDA approved. It's gone several steps through the FDA. It's not just emergency use authorized. It's beyond emergency use authorized. And so it's one of the leading test kits in the world. And it's really accurate. I'm very satisfied with the results. Otherwise, I wouldn't use it. Otherwise, it'd be a waste of my time and waste everyone else's time. It make me look foolish. I don't want to be a fool, and I don't want to fool anybody. I run an honest business. I'm a good doctor. I've been doing it for 30 years.
Yep.
So the tests are very accurate. And so those numbers are very true. There isn't that much coronavirus on Kauai. There's not that many people that got infected. Of all those people we asked, everyone thought they had the coronavirus before. Everybody. And the same thing in Oahu. So if I ask 1,000 people, did you have coronavirus, you think? And they'll say, yes, I was so sick in February. I was so sick in March. But no, we didn't. Because if we all had the coronavirus, we would be just like New York City. It would have been a major outbreak. It would have been disaster. Because we have small hospitals. We don't have the infrastructure to take care of that many sick people. It would have been like a nightmare. But we were very lucky. So not that many people had the coronavirus. Very, very few compared to the rest of the United States.
Okay. Now this drug, I guess they're calling a hopeful one, remdesivir.
Yeah, remdesivir.
How is that? What's your knowledge on that?
So remdesivir is an HIV medication. There's an oral form and an IV form. And what they found that it's able to help people decrease their length of sickness. So if they were going to have been sick for 2 weeks, it can shorten it maybe to 7 days or 10 days. So it helps. It helps. And then the steroids help. The methylprednisolone and the prednisone, the corticosteroids, those help also. But those help in general for a lot of infections. Those help. So if somebody who's very sick and they're septic and their blood pressure is dropping and they're not doing really well, we give them steroids. And the same thing with coronavirus. And they're finding that, if you give them steroids, but it's not a miracle cure. It's the same thing how we treat other illnesses when people are really sick. So if they had the flu and they're really sick, we'd do the same thing. But remdesivir, they're looking at it it decreases the length of sickness, the length of the illness, so the duration of the illness. But nothing's been curing it yet. Just the body fights it, and just like the flu, it the body gets overwhelmed by the virus, and then the body starts fighting with its own antibodies, and finally the body wins or loses. But most of the time, the body wins.
Mel?
Doc, if there are any other strains of this COVID-19 around the world, different strains, or is this the strain and maybe some mutated strains? I mean, that's a question from one of the viewers.
They think there are 3 different strains, but they're all very similar. They're not finding there's a lot of information out there, but some people say some of the strains are more virulent than others. But I don't have any proof of that. But there might be some difference in the strains' virulence, meaning some will cause worsening infection, or than other ones. But I have no proof of that.
I noticed they did, the CDC, I guess, added some more symptoms to the list now.
Yep.
Diarrhea and vomiting or nausea. And there was one more, sniffling or sneezing or something like that.
Yeah, runny nose. It used to be,
nose, yeah.
Diarrhea was from the beginning. That's why I was surprised when they added the diarrhea. Diarrhea was from the onset because it's transmitted in the feces too,
Mm-hmm.
So I thought that was unusual, but yes, they're adding more possible. But a lot of the people we had very mild symptoms. Of the 50 people we had diagnosed, most of them had just mild symptoms: runny nose, maybe a few had loss of smell, sore throat. Some had the classic fever and the upper respiratory, but of the 50 plus we diagnosed, none of them were hospitalized. They all went home and were treated just with antibiotics, what have you, in case they had a secondary infection, and they got better.
It was very hard to detect. I mean, pre-COVID being talked about, I mean, there was a lot of people, I would guess, that came in with flu symptoms or respiratory symptoms that may have had the virus before.
It's possible, Mel, but I think if we had that much corona, we would have had a big outbreak, a much larger outbreak than we had. I think, like I said, I think we just were really lucky that. So one thing that's interesting, we're lucky that it's hard for the Chinese to come here to the United States. It's really difficult for them to get visa. And so we don't really have that much tourism from the Chinese. We have mostly Japanese, right? But if it was the other way around, the Chinese sometimes can go other parts of the world quicker, like Italy. Well, look what happened. And I think that's why Italy got overwhelmed, is because the Chinese could go there in much more larger groups than they can come to us, So, but I forgot now. My mind's strained because I got a patient. I got to step away for a few minutes and I'll come back. You guys kind of talk it out. I'll be back. Okay.
All right.
Get some questions.
Yeah.
We got a bunch of questions.
You got it. I'll be right back. I promise.
I tell you guys, working with this guy on the line on Wednesday was just like that. I mean, he's like intense. He had a cooler with water and Red Bull. I don't know, all different kinds of chilled coffee drinks. But that's what this guy does. I think this guy is he's like the what do you call it? The Duracell bunny. He's running all over the place.
There's a bunny.
So yeah, good. Send your questions up, and then we'll go ahead and ask them. I did want to talk to him a little bit about the testing itself, but
Yeah, I'd like to take this opportunity again to thank you, Brother Mel. I also like to take the opportunity to thank the management and staff of the Kauai Beach Resort. Also, Terry Wilkerson, who joined us, Rhonda Morris, as well as Tyson Moises that jumped in. Dr. T and his staff, of course, they came up. I also like to thank my beautiful wife and getting Pono Business Solutions on board to get the tickets for them to fly over. I know he does want to come back and take another try at it. I think, for all intents and purposes, getting some data and putting it down on paper and keeping track of where we're at. Some people might look at this tonight now and say, well, even Dr. T is saying we hardly have anything. That's true. That's true. But the one question I am going to ask him on when he returns is that, okay, China, we can't get anybody in from China, right? But we can get people from Texas, Arizona, and Florida, where they are the hottest or the hot spots that's popping up by the thousands. Okay, folks? So, and that's no joke. They are popping up by the thousands. So it will be very interesting to ask Dr. T what he thinks about those hotspots, along with asymptomatic carriers. And so that's why we talk about getting on the plane, being asymptomatic, right? Get away. If they don't take the test, they can do the test on here. But then we play the cat and mouse game. And, I ran into maybe a little disagreement with how the testing is done. But we know that when you come into the state of Hawaii, you're going to be given an app. Well, the app itself tells you there's two numbers to call. One number is for visitors, one number is for returning residents. They can call you. If you're not there, you respond to this number. And from there, you will have information put on that when you call that number, you will then be asked questions, if you're still there, whatever. The thing about it is, nobody tells you if the numbers that they give you and you call, whether it's going to validate whether you have that location or not. So that is something how they're checking the people right now. And we're talking about how the testing was going as far as quarantine, how they follow up with everybody. But Doc, the question that I did have for you.
Yes, sir.
And it's a senior moment. I just forgot what it
Okay, good. Let the younger senior take it.
All right.
I will be traveling. If Joe Torres doesn't test and is asymptomatic, there is a chance I can get it. But I don't know he didn't test, and I go about my daily life and am potentially infecting everyone. Is that a concern? So basically, you're in the plane, sitting down.
Guy next to you might have it. Right. Exactly. I got it. But the problem is, we can't assume that everybody has it. If everybody has it, it'd be really bad, right? Not everybody has it. A small percentage of the population has it. If we think about, I think it's 0.4% or 0.5% or less than that of the percentage of the population has it, right? So if we take 100 people in the plane, right? Maybe 2 might have it, maybe 2. I know you don't want to have anybody, but maybe 2. Well, if you're unlucky to sit next to that guy or girl, you should still be practicing what we're advising people to do, wearing a mask, washing your hands before you touch your mouth, Now, you can't really do social distancing too much while you're on a plane. Some planes, like when we flew over for the testing for Hawaii, with Hawaii, was really good. The people who were only sat together lived, were in the same groups. Otherwise, everyone was, separated by one seat, which was really nice. Mm-hmm. But what I've been hearing is now the airlines, as this advances, they're going to start, fully booking the plane. So the chances of you sitting next to somebody that has corona is a little bit higher, but not everybody has corona on the plane. So if you're wearing a mask, I would advise, if you're going to go on a plane, don't just wear a cloth mask. Get an N95 mask. Get a better, or a K95. Get a better mask, and then that way you're protecting your respiratory passageways from breathing in any of the virus that's floating around. If not, also wear glasses or wear one of those shields I invented, or find another shield. And this way you'll protect your face from it getting inside your eyes. Washing your hands is important. You know, you're gonna, if you're on a short plane trip, that's easy not to drink or eat. But if you're on a longer trip, just wash your hands before you eat, because how the virus enters us also is we've touched something where somebody sneezed, then we touch our mouth or we touch our food and gets inside of us. So, or rub our eyes or what have you. You know, so it's just a new way. It's a new world we're going to live in for a while. Hopefully the virus will either lessen or the vaccine will come out, and that'll help decrease the amount of virus out in the general public. But this is going to be our way of life. We're going to have to just be more cautious and, you know, more, protect ourselves more and live healthy. You know, if you're not living healthy, you're not sleeping enough, you're not exercising, if you're overweight, all those things lead to increased risk factors for getting the coronavirus. So maybe all of us in general, as a human population, we should live a healthier life. Quit smoking, exercise more, watch what we eat, and we'll all become healthier, and we'll have less risk of getting the coronavirus or getting the coronavirus and getting really sick. So, but there's nothing we can do to prevent it. If you're going to travel, you're going to have increased risk. So if you want to not have increased risk, don't travel. That's all I can say. There's no perfect solution.
Isn't that? I mean, it's calculated risk, right? Yeah. You know, you don't want to. If you don't want to die with a parachute that doesn't open, don't jump parachute. You know. I mean,
don't jump with a parachute.
Real quick, Charlie. I know you got a question, but I wanted to take off on your mask. Your mask, Rhonda, your shield, your face shield.
Yeah.
Rhonda did a commercial on Facebook Live, and now I am getting bombarded with requests for that stinking mask. And we gotta figure out a way. Do you have that stuff in like storage? You can.
I have it in storage here. It's probably cheaper if they buy it through me than going to New York.
It is. That's the people going on there and they've seen the shipping is like $90 and whatever.
Yeah, the shipping is expensive and it takes a long time. So I got tired of getting so everyone was complaining to me. So I said, okay. So I buy about 500 or 1,000 at a time, and I keep them at the office, and people come in and pick them up in Oahu. I don't know for Kauai what we can do, but I was thinking if they really want them, have them I'll use the email, Dr. T or doctorsofwaikiki.com email. And then they could say, I want so many. I think I got to at least, they need to do a minimum order. I can't just do one shield. Maybe they can get together with their friends and buy all together, but maybe it's going to be 3 or 5 minimum order. And then the price would be, it's $9.99. And I don't know what the shipping and handling with Kauai is. It can't be too much.
Yeah, I mean, or I'm going to volunteer Rhonda. We just
send Rhonda over.
Send us a box, and then we'll just pay you for the box, and then send Rhonda can sell the shields out of.
She can sell them. She can sell them for whatever she can sell them, mark them up a little bit because she had to go and get them.
Well, sure. Yeah.
They're still cheap. I mean, I see there's these people, homemade masks that they put on their face made out of cloth. They're selling them for over $10. They're selling for $12, $13. I go, that's not that much protection.
Okay. Hey, Doc, I know the question I was going to ask you. These, again, we know that Japan has that bubble because of the rate so low. And again, the EU blocked us off from, traveling to their countries because our numbers are so high. Now, when we have places like Arizona or Texas,
okay,
and Hawaii has such low numbers, we know they're going to want to come here.
Of course.
What do you think the state, this one testing process, if you're going to have states that have huge numbers like that, what do you think the state should explore or look into?
Well, here's exactly what I would do, Charlie. It's easy. They need to make an app or some type of way they can monitor the tourists when they come. So if they can't get tested and they want to do the quarantine, that's what they're saying, which doesn't make any sense for 2 weeks quarantine. Well, then you're going to have to download this app and we're going to have to monitor you. And that's it. We'll have to be able to call you at random times. Maybe we're not going to monitor you in GPS, but maybe we'll make you take a picture where you're at, because people want their privacy, fine. But this is a pandemic. In other countries, they did in China and other countries, you download an app and they monitor you on GPS. They say, okay, this is where he is. We know exactly where he's at. He's in the hotel, right? But we're so in America. It's our problem in America. We're all about freedom. in democracy, which is great. But now when you're in a certain circumstance like we're in now, we're not trying to take away anybody's freedom, but it's help protect others. You know, people need to be thinking about other people. You know, if you're young and healthy, great. But if you're not, you're at risk. And so these people at risk are worried that here are these people that are not really getting that sick, and they're going to come and get me real sick, and I might die or get really sick. But I would also bring the police in. So just like when I came to Kauai for the testing with you guys, there was a police checkout at the airport. So before you left the airport, the police wanted to verify who you were and ask where you're going and all these different things. Well, then they should just verify, give them a call, or have some I don't know, volunteer police force or something that can monitor everybody where they're going on the island. It's not hard to do. There's not a million hotels. There's only so many hotels. There's only so many Airbnbs. There has to be a process. So I would do the PCR testing, which Ige said that they're going to do, which is great. I think if they can't do the PCR testing and they still come, they should go in quarantine, and we should watch them a little bit more closely. Or we'll give them direction where they can go once they land to get tested, and they'll take 2 days and they'll get the results and then go about their business. Now we can even ask for more testing and do all these other things, but we got to be realistic. You know, what's happening also on the testing is a lot of insurance companies now, starting probably next month, they're not going to want to pay for testing, especially they're only going to want to pay for testing if you're sick. What's going to happen is they're only going to want to pay for testing if they're sick. And if you're not sick and you want to do it for travel, you're going to have to pay out of pocket. So it's going to be another expense. And a lot of people are going to say, well, I'm not going to pay for that. You know, that's going to cost them $200-300, you know, but that's the price of traveling. If you got enough money to travel and go on vacation, then you should take that in consideration. That's part of your travel expense. But there is no perfect solution. But I think we can man up a little bit and get more people power and monitor people a little bit closely. I think we should make, like we do for neighborhood watch groups. They should evolve that into like a neighborhood watch, for Waikiki and all the different areas. People can police, people policing other people is not illegal. If they see some suspicious activity, they think those people should be quarantined and they're not. They just got to call the police and the police can investigate,
They got that going right now with Angela Keene and that quarantine couple breakers. But I wanted to ask you, you made a mention about the closeness in air, and them packing the planes. Now,
yeah,
they dismiss the fact that the droplets that's emitted from either talking, coughing, whatever, it's not aerosolized, correct?
No, it's aerosolized. It's floating around in the spit, of course. I mean, there's a video that Japan. I was just watching it again the other day.
With the laser.
Whenever we talk, the louder we talk, the more spit comes out of our mouths and floats around. It doesn't like float and then drop. It just stays floating around in the room. If there's no air circulation, it stays in there for 30, 40 minutes. And then maybe later starts to settle. But if there's a window open or something, or there's a breeze, it'll go out. But if there isn't anything like that, and we're isolated in a small area like a plane, it's floating around everywhere. So
if that's the case, and we're sitting in a plane, and they've got that AC going in a plane, then we're actually talking about long, but the duration of the flight. That's how long we're talking about exposure, correct?
Right.
Okay.
Yeah, but that's why I said everyone should. I wouldn't. So when I travel, I wear a mask, but if I'm going to go on a long flight, I'm going to wear an N95 or a K95, especially if I'm going to the mainland or I'm going to be associated myself with people from the mainland. I'm going to wear the best mask I can find, and I'm going to wear a shield. I'm trying to make a new, and this sounds funny, but I'm trying to make a new device that's comfortable to wear on the plane and that will cover your whole head and use positive pressure so that you don't have to wear a mask, but it's kind of like a helmet. I'm trying to design a space helmet so that you can wear this on the plane. It sounds funny, but make it inexpensive for the general public. And so when you travel, you wear this and you're not going to get sick. And also I want to design it for first responders, because the biggest problem when you're a first responder is that it's not comfortable, all the gear you're wearing. So we make something comfortable that covers the whole head, and it uses positive pressure, meaning it's taking air from the outside, having it being filtered, and then forced into your helmet. And then it nothing can get in from the other side. It doesn't have to be sealed, just air is flowing always through it. Now they have things like that, but they're very expensive. They're $3,000-$4,000. 3M makes all these. But I'm trying to see if we can make an inexpensive one that the general public can have. Maybe if it's under $100, and then everyone would buy one. Everyone would like to be protected. And then first responders could wear them all the time, and then they'd feel safe. They wouldn't have to wear a mask, and then people could see their faces. So I don't know. If I don't do it, someone else is going to do it. Someone's going to make all these products are going to come out until the corona goes away. People are going to come up with, make it, safer for us to do things, because we can't just hide at home. We have to go about our business. We have to go about living.
Mm-hmm.
And so if we can do it safely by protecting ourselves, that's what it's going to be. It might, we talked about wearing helmets and shields and masks, 5, 6 months or 7 months ago, everyone thought we're crazy, but now it's like, it's the norm.
Yeah. Okay. Thank you.
Yeah, I saw a video. They were talking about that if you can, you see all these guys vaping.
Yeah. Oh yeah. It's spraying out.
Is that indicative of what it'll look like? I mean,
microscopically, it looks just like the vape smoke coming out.
Yeah, that scared the crap out of me, man. That just scared. Oh, I'm kind of.
But that's why you gotta wear a mask. If you're in a closed space with people you don't know that are from higher risk areas, you should wear a better mask. That you got to think about it. The thicker the mask, the higher the filtration, the less likely that virus is going to get in, and vice versa, and you're going to spit it out. So that mask is designed, the N95s are designed on a certain micron level based on the size of the virus, not to be able to penetrate that filter, And so it makes sense. It's not comfortable, but it will protect you. The best scenario is this: you wear that mask, and like I said, you wear a shield and you wash your hands. The likelihood you getting is very, very low if you do all that,
Doc, they're finding more and more younger people getting COVID and being affected by COVID. And more people are getting tested, so we're finding more. But what precautions should these students, these guys going back to school, they're going back to the college life? You know how that goes. It's like a bar, right? You know what happens in a bar. As it relates to testing, you recommend them, and I agree. I mean, I think at some point the insurances are going to say sorry, especially for travel. We ain't paying for that. No, man, you pay your own.
Yeah.
The college kids and testing. What any recommendations for those guys once they're back in on the campus?
Well, I talked about this before. I think coronavirus is kind of like a new STD. So increased risk to get coronavirus, if you're sexually promiscuous, increases your risk because you're having really close contact with that person. You're breathing each other's air and what have you. And I think when you're associating and the young people are hanging out with each other, they're all talking real close to each other. They're hugging each other. And so they're going to be increased risk. Luckily, the younger population very rarely gets very sick, but they become carriers and they can, spread the illness to other people. And that's the difficult part, So I think because of social distancing outside of those networks and wearing of masks and shields, that will protect the other people. So even if they're infected and they're asymptomatic, if we're practicing social distancing and the masks and shields and what have you, washing hands, the chances of them spreading it are less, right? And they're going to hang out with people their age and spread it among themselves. But when they go somewhere like a grocery store or they're going to class, I've heard, many different versions. Some schools are saying no masks. Some are saying masks. I don't know. I would implement masks at all the schools. All the colleges should wear masks. And the students should wear masks, even in grade school, until this passes. It's not a big deal wearing a mask. Everyone will adapt to wearing something on their face. After a while, if we get control of the virus, we don't wear the masks anymore. It's not a big deal. Everyone's making a big deal about having to do certain things outside the norm, but that's what happens. Things change. We're going to have to evolve into finding a way to deal with this. And like I said, maybe people will come up with better ways to protect us. Maybe, like I said, people will make a helmet. People will do this, do that. But we cannot just say I'm an American and I want to be free and do what I want and I don't care. because yeah, I don't care if it affects just you, but it affects everybody else, you know. It's becoming like a social dilemma, you know, because everybody wants to go back to work. Everybody wants the economy to go back the way it was. Everybody wants to be back to normal, but we're going to do all that. But there might be some restrictions. We'll have to wear masks. Maybe we'll have to wear other products to protect ourselves. But if that's what it takes, that's what it takes.
Doc, people, again, we're still getting bombarded with the masks. They can buy it from your office if they're on Oahu.
Oh,
They can
yeah.
walk into Doctors of Waikiki. Can you
I
let
have
them know
them.
where you're at again and which hotel?
I'm at Princess Kaiolani Hotel, the Sheraton Princess Kaiolani, right on Kalakaua, right by Urban Outfitters, across from the Surfrider Hotel.
Yeah.
This hotel has been here forever. It was so it's really cool, the history of Princess Kaiolani Hotel. It used to be Princess Kaiolani's house. So Princess Kaiolani was given a house where this hotel was, 100 years ago. How long ago was that? And then she passed away, and then the house and the property was put up for sale. And then a local company bought, I think it was a shipping company. And then this, after so many generations, this Japanese family, Kyoya, they bought it. So they own Princess Kaiolani Hotel, which is a Sheraton, Princess Kaiolani, and they own about 3-4 other hotels on the island. But it's got a lot of history. I haven't seen any ghosts yet, but they say there's ghosts here. But
and you're there till midnight every night. I mean, not you, but
I'm
your
here till
clinic is
midnight
open.
later, till 1 o'clock, 2 o'clock. Sometimes I'm too busy. I got to catch up on my paperwork, and I haven't seen any ghosts, but they say there's ghosts. So I'm waiting for Princess Kaiolani to come.
Oh God, you should have never said that, Doc. You should have never said that. Oh my gosh.
Yeah, she's
No,
gonna come.
I'm joking.
Yeah, I hope so, because she'll come tonight. And,
No,
we're
I'm
not-
joking. I'm joking, Princess. You rest in peace. But yeah, they can come buy the shields. I have them. Like I said, if they want to email me, I'll figure out what it costs to ship them, but I can't ship like one at a time. I'd rather ship 100, and then whoever wants to deal with it, they can deal with it.
I think we'll do that. I'll talk to Rhonda. I think Rhonda's on, but I think that's probably the best way. Is just
Okay.
Just because you can ship the 100 in a box for much less than shipping individual.
Right, shipping individually. Right.
Yeah.
I think that a box of 100, I think, weighs 15 pounds. It's not that heavy.
Okay,
then,
Doc, we got about 10 minutes left. I kind of wanted the testing. You came to Kauai, you did antibody testing. You
Yes.
saw the response. You saw, what did you get out of that testing? I mean, the people.
Well, what I
there
got
are
out
a
of
lot
the
of
testing,
people that didn't know, and they're like bummed out. But what did you get out of that? It was probably your first time you did a COVID testing event on Kauai.
oh yeah, it was first time. What I like is that we didn't have that many positives. One positive out of almost 200 is really, really low, which is great. That's really cool. So that means, again, that Kauai is pretty safe. In Kauai, you guys should be happy. You guys should be patting each other on the back and saying, we have a pretty safe island for coronavirus. The likelihood we're going to get sick and die from coronavirus on Kauai is very small. And then if they implement these changes, when people come to Hawaii and come to Kauai and they're being tested or they're being quarantined, the likelihood of Kauai having a major outbreak is very small. And so that's quite a relief, And you think about it, population-wise, Oahu's not even that bad. Like I said, Oahu has a very low rate also, and probably all the other islands as well. And when they check first responders, like my numbers compared to the first responders numbers for the antibody test that they did at the hospital, same, 0.4%. And these are the people that are in contact with coronavirus all the time. We should, if you think about it, if it was that infectious or we had that many, we'd all have it, but we don't. Very small percent, That means 4 out of 100 first responders had antibodies. Doesn't mean they're very sick. 4 out of 100. And on Kauai, it's 2 out of 100 people. 0.2. Yeah, I think that's what it comes out to. 200.
Yeah,
actually, 0.1. Yeah, 0.1. One out of 200. I think I'm not good at math. 0.1.
Right on.
0.05. What it comes out to is 0.05. 0.05 antibodies. If we use the 200 as a,
No, my friend just texted. He said he's gonna be coming home Wednesday, so he can bring the box home and not have to pay shipping. So we'll let
You got
know.
it. Okay, I like it. Just tell me when he's coming and I'll have it ready.
Roger, got it, got it.
But I
So
think
the-
we're all blessed that we're in Hawaii from the aspect of the coronavirus. The only difficulties we're having is because majority of everyone's business revolves around tourism, you know? So maybe everyone needs to reinvent themselves. Maybe we should look into doing more things without relying on the tourists so much. Other businesses, maybe get back into farming, get back into some other aspects of, if it's possible, you know, maybe get into manufacturing, doing something different, not just tourism.
Yep. Hey, Doc, one last thing. We always worry about this so-called second wave based on the small viral load that we're seeing now in Hawaii. Do you think we'll ever get a second wave? What's your opinion on that?
I think we're already seeing the second wave. This is it. We're not going to see that many people, but we'll have higher numbers here and there, and then they'll patter down, and then it'll happen a little bit more. But I think it'll be like a little bumps. You know, we'll have the big one, and then little ones, and then smaller and smaller and smaller and smaller. They'll never. If we were able to isolate ourselves totally, it'd go away. But in reality, we can't isolate ourselves that much. But we can do what we're doing. You know, testing and quarantine, and then we take, these precautions that we talked about. But I don't think we'll have a big resurgence, Charlie, because we're able to control the flow of people coming in and out of Hawaii. And I feel very confident in that. Unless all of a sudden we said everybody come free for all to Hawaii, well then yes, we'll have a big resurgence, because all these people in areas that have a lot of coronavirus, you say, I'm out of here, and they're all going to come to Hawaii, and they're going to bring it with them. But if we're testing them or we're quarantining them, then the chances of us having resurgence is very, very small, very small.
Mel?
Just another. He's got more questions about the masks. Thank you, Rhonda. Can you ask you if the shield that can be worn with a hat is the same price as the normal?
It should be the same price. Once that one comes out, the one I gave it to Charlie. It's not a product. It's done. And now we're going to start selling them. So once I get a whole bunch of them, I'm going to start selling. I'll send boxes to Kauai too. Then that's not a problem. But I don't have any except 4 or 5 of them. The one I gave to you, Charlie, like I said, is kind of like a prototype. But yeah, you can wear it on your hat. It'll be the same price. It'll be the same price.
Charlie's so special. He got one.
Yeah, well, I'll send you one. I got one more. I'll send you one.
That's all right. I'm good, man. I'm good.
Charlie's a hat guy.
Yeah, he is. He is. I don't know if you noticed, I had a hat too, Doc, that day.
Oh, I didn't notice. I'm sorry.
Actually, Doc, I didn't have a hat, and one of the guys passing by saw my flushed face and my
here's a hat.
wet head. He gave me a hat. He told me, "Oh, my good friend Lawrence Kapuniai is actually on this show tonight. Thank you so much. I love you guys, man. They gave me the hat."
We couldn't have done the testing without you and your friends. I mean, it was just so hot, and it was so many people. You guys helped so much. Thank you. Again, I want to give you a wholehearted thank you to all of you that helped us that day. It was really hard. It was really hard. It was very nice of you guys all stepping up the bat and helping.
Well, it was. We're so happy. I mean, I think, Doc, Charlie and I have been begging for this to happen. I don't know why we didn't call you earlier, but
I don't know,
because you're on TV every night. I watch the news. We see a commercial. I figured, man, that guy's he's a big time. He's like Waikiki. Whoa, big time.
Well, I don't think so, but okay.
I wish everybody had an opportunity to meet you face to face, and they'd see you're just a normal, cool dude, man.
Thanks.
Hey, Doc,
yes.
Knowing the numbers now, some
Yeah.
people are asking that couldn't get in on the last testing. Would it be advisable to go through any more testing, or what's your read?
I mean, I'm okay with doing testing again. My only concern is going to be because the insurance companies are changing their whole vibe about testing. it might cost some more out of pocket expense if I come in July. That's all. But if they want me to come in July and there's enough people that want to get tested, I'll come in July. And what I'll do is I'll just bypass the insurance and charge probably, like I said, the cash pay $49 for the test if they really want to get tested. Because insurance they're really pushing towards not testing unless you have symptoms. Okay. So if people just want to know something, it's like, I want to know my blood type, or I want to know if I had this. Well, the insurance in the beginning was okay with that, but now they don't want to do it. I think that's what's going to happen, but we'll see. If people are willing to do it and they want to pay a little bit out of pocket, I'll come, because I can't do it for free. I have to charge something. I got to cover my expenses and my time to come out there and do everything. It's, it's either, but I if they really want to, we can. But I think because our numbers were so low in Kauai, that even if I tested 1,000 people, it wouldn't be any different, or 5,000 people. My feeling is if we tested the whole island, it'd be the same number. We'd have, out of 1,000, we'd have, so many, very few people that would have antibodies. And hopefully that's how it's going to stay.
Okay.
But if,
well, I know we're getting a lot of requests for that, and we'll talk later. I think we're gonna really see what the interest is and how many people could actually come. I mean, you would probably need at least 100 or 120 or so, I would guess, to.
Yeah, I don't think it'd be difficult, but I think 100 people would show up. But I'd like to make it fair, and like I said, I got to find out because after the 30th of June, the CARES Act ends. So the CARES Act was implemented from the United States to assist with the pandemic. After the 30th of June, I don't know what's going to happen with testing and everything else, but I've been hearing through the grapevine that the insurance companies are going to look to not really pay if they don't have to. So we'll see. If everything's good, I'll come out in July.
Okay.
Well, no, that what that means, Charlie. Your message box and my message box are gonna get blown up tonight about, yes, I want to test. I already got like 80 people asking me for. I sold 80 shields and you don't even have it yet. We're gonna send it out to Rhonda though.
Wow. Okay, good. We'll get the shields out there.
I tell you what, the shields are now $25 a piece. I'll take
whatever. Whatever you guys want to sell them for. I'll sell them for $9.99. Whatever you guys want to sell them for. But they're cheap. I'm looking at things that people are selling. They're expensive. They're selling those cheap Chinese ones for over $10, and those Chinese ones are no good. They don't even protect you. But they don't.
I know. Patsy got one. Patsy got a shield too. I don't know if you remember giving my wife one. She got one.
Yes, I do. Yes, I do.
I think I was the only one that didn't get one, but that's okay.
Oh, well, we're gonna have to send one for you.
But I did want to say thanks, Doc. And I know Charlie mentioned the Kauai Beach Resort and
yes, thank all of them.
What's Pono Business Services?
Yeah, for the toilets.
This is the
Yes, that was nice.
Lenny Raposo from Garnal Public. I mean, public. Portable toilet rentals, guys. These are the people that you want to patronize when you need to use those services, because they stepped up, and so did Dr. T. I mean, and his whole staff. We had so much fun that day. I mean, in between Pastor Jonathan, Juliet, Paul, Tiana, and Christine, we just had a good time, and I just wish it wasn't so damn hot, but we'll definitely, if it happens again, we'll try to. Charlie's gonna get us a much cooler place.
All right. Yep. We'll try to figure that out. But put your feelers out and see if you guys want to do it again in July. Maybe we can work out something.
Okay.
Any closing comments for your new friends and your old Doc? You got a lot of old patients that I mean, you had a lot of patients on Kauai, and they were so.
I had a lot of patients on Kauai. I know, but you know how life is. Things happen, and you got to do what you got to do. But I love Kauai.
Yeah, well, that was pretty obvious on Wednesday. That was so obvious. So what's your closing comments or thoughts or advice for everybody here on Kauai?
My advice is, everyone will get through this. Not to worry. Stay safe. Love your neighbor. Love yourself. And just give it some time. This will pass. This too shall pass. Everything will get back to normal. just got to be patient. We got to work through this.
We got to be safe. And I just have one, before we shove off, I want to just ask a personal request to all of you out there. And I know some people want to take this in a wrong way, but it's not directed at anybody in particular. But if you're going to violate your social distancing, if you choose to do that, please don't post a picture on Facebook.
Yeah.
It really irritates a lot of people. We all know what we got to do. We talk about it every night. We talk about all of that stuff. And I understand people, have been locked up for a long time. But if you're going to go hang out and you're going to do your thing, don't post a picture of you guys violating social distancing, because that just makes people feel like they're doing all of these sacrifices for nothing. Because even though the viral load is low, we get complacent. Once the visitors start coming, so much easier to transfer this damn thing. So that's my request, Charles.
Yep.
Any
Well,
closing comments, Charles?
yeah, first of all, I'd like to thank Dr. T. Thank you so much there, Tony. I appreciate
You're welcome. You're
the
welcome.
professionalism and trying to help us navigate, because, I think now more than ever, getting it straight from a doc like yourself. We've had many doctors on, Miskovich and O'Kara and all of them. And,
Sure.
we appreciate their time too. But, because we work with you, I want the people to know that, you're pretty confident based because you ran the test, you ran the numbers. So you can do that relationship to show that, if there was to be a spike, it'll be so low. It'll be
Right.
so low. So everything will be in proportion to what's happening now. And so I think, if they understand that, then good. So that kind of helps us in now looking at, again, we're going back to the old saying that the state got scrubbed. We had that opportunity. We got ourselves scrubbed clean. And yes, we're in a second wave because there's been periods of time where there's nothing. So that warrants that second spike to come up, and that's the second wave. Everything from this point on, it's all about what happens when that new set of travelers come here. What will they bring to these islands? So I think Dr. T's message for all of you out there in viewership land is that he is saying, even though the numbers are low, we have to continue to practice the safe distancing, washing of the hands, as well as wearing the mask, because we don't know when this thing is going to pop up again. And like you said, it'll be when we get a vaccine that we can be a little bit more comfortable. But right now, we just have to be diligent about what we do. And again, we have professionals like Dr. T. And for those of you traveling to Oahu, something happens, over to the
Doctors of Waikiki.
Yeah, Princess Kaiolani, and they'll pick you up in one of those Back to the Future cars. The doors come up from the side. Yeah, they'll pick, they'll
Exactly.
pick you up. So if anything happens, check out Dr. T and his gang over there. They'll help you. So thank you, Doc.
Thank you guys. You guys, thank you so much. Have
Stay
a wonderful
safe, guys.
evening.
God bless. Tomorrow night, we
bless.
take the night off. Monday, we will be back with Representatives Gene Ward and Bob McDermott to talk about some of the things that's going on at the legislature. So until then, God bless. Stay safe. Good night. We love you guys. We'll talk to you guys soon. Aloha, Doc.
Hello, Doc.
Aloha. Aloha.